last episode, Dr. Jason Jian made an analogy between diabetes to depressions, and they say like they are really, really similar. So Dr. Jason Jian, like what does that mean to our patients?
When you talk about diabetes, similar like depression or anxiety depression, or similar like diabetes, from your point of view, how do you understand?
So diabetes is because their like chemical like insurance is unbalanced. It's like similar like the depression and anxiety.
They all chemical imbalance, but the more important is they are both treatable, manageable, but not curable. Diabetes, you know, if you are getting glucose under control, the patients can be live as long as 80 years old, 90 years old. Many patients with the diabetes, they will find out they have diabetes probably around 40 years old, 45 years old. If they are get under control, they can live as long as 80 years old, even 90 years old. But if glucose are not under control very well, they probably will develop complications like strokes, heart disease, kidney failure by 50, 55 years old. Then many people will die from the complications like strokes, heart disease, kidney failure about 60 years old. So they die prematurely. Similar like depression, anxiety. Currently, the problem is many patients with the depression, anxiety, they treated the depression, anxiety like pneumonia. They thought they were comes and goes. So once they feel better, then they stop medications. And most patients with the depression, anxiety, they typically just take antidepressants for about 1 month or 2 months. Then they stopped. They thought they get over the problems. After several months, the problem come back again. Then they take medication again. In this way, the back and forth, they cause huge problem. Number one problem is they will develop tolerance to the medications. Second is because when you're not getting depression, anxiety under control, the worst thing is they will not take care of themselves very well. They will neglect themselves. Then they will develop like diabetes, high blood pressure, high cholesterol much earlier than general population. Probably they will suffer those chronic conditions by 30 years old, 40 years old. Because they are not taking care of themselves well, so they will not get diabetes, high blood pressure, or high cholesterol under control very well. They will die much prematurely than people with without depression, anxiety. So they have severe consequences. Once you understand the depression, anxiety is chronic by nature, then you should understand you need to take medications for years to come. Let me give you another analogy to help you understand. Do you remember last time we talked about engine oil leaking and stop leaking fluids, right? Yeah. You can see, like the last time we mentioned, the serotonin similar like engine oil. The Zoloft, Prozac similar like stop leaking fluids will not replace the engine. So we have to use the stop leaking fluids regularly, once a week or twice a week. Once you stop stop leaking fluids, the engine oil leaking will be stopped again. Similarly, like Zoloft, Prozac. Now we are not really cure the leaking. The leaking is still there, so we have to use the Zoloft, like Prozac, regularly to stop the leaking. So that's why that's so important. You should not stop the medications. Some patients we ask if it's possible to stop the antidepressants. Theoretically, yes. When some patients with the first episode of depression, anxiety, we call first episode, they can consider stop the antidepressants or anti-anxiety medications after 6 to 9 months, but which is better under the psychiatrist or provider's supervision to gradually decrease the dose. Then you can try to stop. If the problem come back again within 6 or 9 months, then we can call recurrent episode of depression, anxiety. Then we will recommend don't stop medication again. The reason is because some patients with the depression, anxiety, and the first time, possibly it's because they don't have the leaking. They just have overwhelmed by stress, by work situation. So those things not because we cure the leaking, it's because diagnosis probably is not accurate. That accounts for about 1/3 of patients with the depression, anxiety. If they will have the leaking, probably it just cannot stop it. Another thing is we know, like any other chronic conditions, we need to take antidepressants at least 5 times a week. This is also hugely important. Many people treat the antidepressants like as needed basis. This also can cause problem. It's because research found out any medications for chronic condition, including diabetes, high blood pressure, and depression, if you take below 80%, any medications will not be working. So we should not treat antidepressant like as needed basis. Otherwise, that will not be working as well. So this also reflect the depression, anxiety is chronic by nature. So also some patients treat the depression, anxiety like tumor. Very few people treat the depression, anxiety like tumor. I think they thought their life is over. That's probably over-exaggerate the nature of the depression, anxiety. So let me clear, anxiety, depression is more like diabetes, not like pneumonia, not like a tumor. They are treatable, manageable. If your depression, anxiety get under control, you can live as normal life as everybody else. If you don't tell people around you, they thought you're perfect. They even regard you as role model. But similar like depression, like diabetes, if you are not get under control, then your life will be dramatic, especially quality of life will be dramatically decreased, impaired. So I advise patients with the depression, anxiety, you should take the medications seriously.
Thanks for answering all our questions today. And please don't forget to subscribe to our channel so you won't miss our following videos. Thanks for Dr. Jason Jian comes to our studio again.
Yeah, I'm glad to be here. And if everybody wants to know more about depression, anxiety, attention deficit, or opioid dependence, please contact my office.